Let's talk about day 6 post-op following your total knee replacement. If you guys don't know me, my name's Tony Maritato. I'm a licensed physical therapist, and I saw a post come up in the Facebook group, Total Knee Replacement Support Group for Kind People, asking about day 6, what should be expected. So I'm fortunate in that I work with a lot of individuals who have had knee replacements. I help with their recovery, and typically by day 6, we're kind of hitting the second wave of challenges. So when I talk to new patients or patients before they have surgery, I kind of explain to them, you know, the first 24 hours you kind of have all of the pain meds and everything that they use during the surgery in you. You're kind of groggy, you're kind of out of it. So the pain isn't usually that bad the first 24 hours. Then you kind of hit the pain wave that comes in, and it starts to, you realize the soreness, the tightness, the limitation. 48 hours, 72 hours, it's kind of in that window. Then it starts to get better. But then as it gets better, you start to do more, which is totally natural. That's totally a good thing. That's not a bad thing. But with the increased activity, you start to hit that second wave of increased pain, increased soreness. I typically see patients lose a little bit of the range of motion improvements that they had been experiencing by day 6. And then they usually turn a corner somewhere between day 10 and 14. So it's totally reasonable to feel an increase in pain and soreness around that time. It's totally reasonable to kind of take it easy a little bit. You know, your workouts, your physical therapy, your exercises are going to be variable based on the day and how you're feeling. Some people who have a lot of blood loss might be a little anemic. You might have a low energy. Other people might still be experiencing nausea. Certainly some people by this time are still dealing with constipation or diarrhea. There's complications with the pain medication. So there's a lot of things to factor in here. Plus hydration. You're probably not sleeping all that well. The accumulation of poor sleep will start hitting you around that time. So my best advice to anybody that I'm talking to is give yourself a break. Be lenient with yourself. If you feel like you need a little more recovery, if you need a little more rest, go ahead and take it. Talk to your physical therapist. They will vary the intensity of what it is that you're doing. But understand that day 6, day 7, day 8, totally reasonable to feel a little worse than you did day 4 and day 5. It does get better from here. So guys, keep posting your questions. I'll do my best to keep answering them. And if you want to see the next video that YouTube is recommending, go ahead and click on this thumbnail right here. Otherwise, I'll catch you on my next video.